It is Wellness Wednesday in this sponsored segment. Today we are talking to Dr. Tarek Pacha, a board-certified urologist with Memorial Healthcare, who is here to talk about a surgical procedure called aquablation to treat men with enlarged prostates. Good morning to you.
Good morning. Thanks for having me on.
Yeah, thank you so much for coming in. Let's talk about this procedure and option for people and how you're at the forefront of this.
Yeah, actually, we're one of only 2 institutions in all of Michigan to have this version of aquablation, which uses robotics and artificial intelligence. Very exciting.
Yeah, talk a little bit more about how this treatment is kind of different from other options out there.
Sure, it is, again, like you said, it's a minimally invasive procedure that's to treat benign prostatic hyperplasia. That's BPH, or also well known as enlarged prostate. What's so cool about it is it uses a robotically guided water jet to remove the tissue, the extra prostate tissue, to the millimeter, which is in that we're able to have that much precision because we use artificial intelligence, giving an excellent result with very few side effects. It's quite remarkable.
Well, and why do you think it's great just to have this option, period? How is this making treatment better for men?
If you compare aquablation versus traditional surgery like the transurethral section of the prostate, which has been around since the 70s, there are a lot of significant side effects. So with this surgery, you can almost look at it as a 2.0 or a updated version of the gold standard for enlarged prostate. That for men that have all these voiding complaints, very disruptive to their life, they are now allowed an option that's not only minimally invasive, but extremely precise compared to traditional surgery.
Well, and you get to see the impact firsthand, so kind of talk about what you've seen.
Absolutely. So what's so remarkable about this is the instant results. Now, like any procedure, there are going to be some side effects, such as bleeding, frequency, and urgency, but usually they're temporary and self-limiting, only lasting about 1 to 2 weeks, and it's very not disruptive to their daily life, and it's a quick recovery compared to traditional surgery.
Well, and what does that mean to you as far as caring for patients and making sure they rebound more quickly?
Absolutely. So again, you're absolutely right. To provide a therapy that when men are frustrated with their symptoms, unable to empty their bladder, waking up multiple times at night, spending a lot of times in the bathroom or even bathroom mapping, going to the first place you look for is a bathroom, this provides a legitimate, minimally invasive, precise solution with minimal downtime compared to traditional surgery.
Do you think this will encourage more men as well to seek out aquablation?
It's a great question. And the most important thing, not only about the symptoms, is when we delay treatment of our symptoms, we actually are hurting the bladder. You can almost think of it as like congestive heart failure, there's congestive bladder failure. So ignoring the symptoms of enlarged prostate or delaying it can cause to severe symptoms as we get older, and even need for catheterization earlier than normal, which is quite awful.
Yeah, so overall, I mean, this is making a positive impact, so people can consult with you, right? And you'll answer any questions.
Absolutely. If someone is, again, this might not be for everyone, but if someone is looking for a precise, minimally invasive option with outstanding results and very few side effects such as incontinence or sexual dysfunction, this might be a great fit for that man. Again, that man with moderate to severe urinary symptoms, frequency, urgency, hesitancy, spending a lot of time in the bathroom, waking up a bunch of times at night. This might be an absolutely great fit to significantly improve the quality of your life with a precise robotic, with the use of artificial intelligence, AI mapping, to give us to the millimeter that type of precision for a patient is quite exciting and thrilling.
Yeah, and you're the only one to offer it in the Mid-Michigan region. Let's show our viewers at home. You can reach out and learn more by going to the memorialhealthcare.org website. And thank you so much for your expertise.
Well, it's my pleasure. Thank you for having us on to allow this information to spread.
Of course.